Thank you and congratulations, VCOS. This is a great forum. I also would like to acknowledge that we're meeting on First Nations land and remind us that we need to cherish customs, traditions, and we have a lot to learn from our First People. I work with Bendigo Community Health Services. I'm the manager of cultural diversity. We're a large community health centre and we've had the privilege of managing refugee settlement for about 12 years. So I'm going to walk you through a program that we've co-designed with our refugee community, why we've done it, what we've done, how we've done it, and then some recommendations for consideration. I'd like to acknowledge funders, the Lord Mayor's Charitable Fund, a small amount of funds, Victorian State Government and the City of Greater Bendigo. Part of the problem is that we've got to cobble this funding together continuously, and we all know the trajectory of climate impacts, don't we? I would absolutely like to acknowledge Bendigo BCHS, bilingual staff. Nido is a Karen gentleman, Marpor, Tamu, their Karen staff, Zahira Zimi, Afghan Hazara, Kunyan Bol, South Sudanese woman, and Sarah Tarquinio. We don't do any of this work without engaging, walking beside and employing and paying staff of lived experience and bilingual staff. I'd like to acknowledge the former refugee communities, and they are former refugees. As soon as someone who is a refugee or an asylum seeker gets on that plane, they are of refugee background. And the project champions, the City of Greater Bendigo emergency staff, SES and CFA who form part of this project. Bendigo, just to give you the picture, is a destination of choice. We've been welcoming intensely people of refugee background for the last 12 years. We are one of the top 10 settlement areas in Victoria. We have around, we think, 4,000 Karen from Burma or Myanmar, 300 Afghan, mostly Hazaras, but not all, and increasing numbers of South Sudanese. One of my issues, and the reason I'm here today, is that the settlement programs that are funded by the federal government, with respect I say, do not have the capacity to build skills and knowledge and capacity to manage fire, heat and flood events, safe and sustainable living and energy efficiency. 50% of humanitarian settlement arrivals in the next little while will arrive in Victoria, and there is a focus on rural settings. The federal government that is currently in are planning, and that was part of their election platform, to increase the incoming quota of people arriving through this program. We need to be ready and we need to do better. People of refugee background come with no public health system messaging immunity. I'm calling it that. It's a term I've come up with. We grow up with 0.05 slip, stop, slap. We understand universal pedestrian and traffic signage and language. They don't come with, they have not had the privilege that we've had of education and access to healthcare. They come with, therefore, very poor health literacy, service literacy, and very poor public health message immunity. There is a lack of translated information that is culturally safe and easily understood, because some of the people that have lived in refugee camps for 30 of their 40 years of life are not literate in their own language necessarily. So to churn out a translated piece of information is not good enough. They have a fear of authority, having been chased by the militia, the Taliban, etc., for all of their lives. And this is a very new environment. Bendigo, Australia, Melbourne, Australia, Victoria is a very new environment for our people of refugee background. They experience different weather events. I have to say that this presentation has all been scrutinised by those three language groups, so I hope I do them justice. Why? There is some expressed evidence about why we need to focus more research and resources on people that arrive with, as I've described. VCOS in 2014 recognised that people of refugee background may express disadvantage when preparing for an emergency, during an emergency and after an emergency, and their study in Feeling the Heat, in which we contributed to, talked about English language as a barrier and a major driver of heat vulnerability. Thank you, VCOS. In 2009, I've worked at the Community Health Centre for a long time in different roles. My background is nursing, health and postgraduate public health. I'm really interested in how we create sustainable, safe, dare I say, happy, viable, thriving communities. I've been a change agent all my life, within my family and community, and I like it. So in 2009, I was part of the Bushfire Case Management Program, and I walked into the recovery centre and didn't walk out for 2 years. At that time, we had 50 Karen families, and in 2010, we started with our refugee settlement program. I have felt uncomfortable in my skin ever since because Bendigo is a city ringed by forest, and I know what happened in 2009 with people most people that came in who were affected could speak English. So we established the project, the Bendigo Community Health Emergency Preparedness Project in 2019. We established a reference group of key agencies, SES, CFA, the City of Greater Bendigo emergency staff, and of course our people of refugee background with voices that we wanted to hear. We scrambled around looking for funds which we haven't secured enough or properly yet. I've cobbled together. Our aim is to build the capacity of former refugees to better understand and prepare and manage extreme weather events. This includes orientation of service providers to understand former refugee communities. So the SES, the CFA and the City, they are all part of this. Our target groups for this project are the major refugee groups in Bendigo, the Dari, Dinka and Karen speaking communities. We first of all started a lit review to see what was available in language across Australia, and Canada has a lot of Karen settling there. So we looked at that. We had staff of bilingual who were bilingual look at these, what was available. We found nothing that we found was suitable. In fact, we found a document in Western Australia in Karen language, and my Karen friend and colleague Nido came laughing out of his office and saying, this document in Karen language from Western Australia says we must outrun the fire. Now, I'm not having a go at anyone who does translate, but it's so important. We've developed a methodology to make sure we just don't print something off from the Better Health channel or anywhere else without actually testing. Does it actually say what we want it to say? So we co-designed fact sheets and audio visuals in those 3 languages on fire, flood and heat. Our methodology is we take a simple English script, we simplify it into words we know can be easily translated into those languages. There are no words for mental health in Karen. There are no words necessarily that translate easily. We have always worked with content experts, in this case CFA, SES and the City. And we simplify the script. We then sometimes send it off to qualified translators. When it comes back, invariably there's a backwards and forwards argument, debate with the translator because my speakers say, no, that doesn't make sense to us. Sometimes, if it's a small piece, we translate it ourselves. We check for accuracy, 2 readers and speakers of that language, and it's piloted with community. Tips. I think when we started with the COVID, I'm up to Project COVID, funded Project 12, with small pieces of funding, which itself is irritating. With respect, I say that no one knew the trajectory of the virus, but we do know the trajectory of climate impacts, so we need to do better. With our translations and our fridge magnet sheets, always have the Karen, the language spoken or written in English. So if you're the service provider, you know what you're handing out. It's always dated and it's always acknowledged where it's adapted from. And we're a great fan of fridge magnets because the power goes out and there is also poor digital literacy. Our project is multifaceted, so we engage, the reference group drives the project. We engage refugee champions. We develop and co-facilitate formal community education sessions and build the capacity of service providers. The champions come in, they are acknowledged and rewarded with voucher. It's not enough, but that's what I've got. That's all I've got at the moment. They participate in 6 to 7 hours of training, fire, flood and heat. They are given a pack and they are asked if if they want to do this, first of all, and we encourage them to go out and have conversations with a minimum of 5 family groups. We on our website, we've got all our fact sheets in those 3 languages, plus audio visuals that are scrutinised and co-designed with those expert content, the content experts, in language by local actors. That in itself, a spoken word by a trusted person in language, is really important. And then, of course, COVID interrupted some of our work, so we developed a QR code system so that when the champions were going out, they could scan and go straight to our website and they could show the videos in language and discuss them. That's just a photo of the champions of last year. Dinka, Dari and Karen speaking. And Nito on the right here is the champion Karen man who leads this work. There's another example of some of the work that we've done with bushfire and flood. That's bushfire and flood. The community education program, it's really important that we emphasise where you live. We're in Northern Country, and that's what the information talks about. We try really hard to introduce the concept and ability and capacity to use the Victorian Emergency App, but it remains a huge problem. We talk about not just that you must plan and you must act. What is planning? What do you do? How do you act? Where do you go? Communication. If you still don't understand and you're comfortable with what we've provided, let's everyone have an English-speaking buddy or some other person in your community that speaks more English than you do. So when your VEA is going off, you do have someone to consult with. We talk about the recognitions of warnings and what that means in a very simple context and knowing when to act. In 2021, over the October to sort of March, April, we had a face-to-face reach with that methodology of champions and community education sessions with SES CFA going out, with big CHS staff, bilingual, who were paid, of about 925, and that was during COVID. Some of those sessions were online with church groups zooming in. We also include a heat wave. I'm going to rewrite this after today. There's been so many hot and fantastic tips about, all the things, the way we want to educate our people about heat wave, and I really appreciate being here today. So we used a simple piece that the City of Greater Bendigo had developed in conjunction with those other partners at the bottom. We simplified it into a script that was easily translatable. Again, we used the bicultural methodology, and we made it into a fridge magnet. The capacity building project component of the project is essential. I never do anything without engaging the service providers involved in projects. So it took me a little while, I have to say, to encourage the SES and CFA to come on board. They didn't see the relevance of it, with great respect again, I say. And the first time I did my Understanding Refugee Settlement session in about sometime in 2020, it was all online, and it was nerve-wracking because I couldn't see behind the circles what the attitudes were. But the feedback was good. I engaged them, and now they can't wait to get to the reference group meetings, and they've got me lined up to do sessions with all of their staff, SES, CFA and the city. We had 29 participants. We talked about who our people of refugee people are, why they're refugees, their pre-settlement experiences, the post-settle complexities. If you go around with a loud hailer in your boat and try and get people out of their flooded houses, they'll be hiding under the bed if it's not flooded. They have a fear. You're in a uniform. They've spent their lives running from the Taliban and the militia. Evaluation data showed that 90% of the 29 small group, yes, we have got new information, and yes, we really do want to do something about this. I'll just let you read that statement. They are really keen to work with us. I am really keen to work with them. And I am very glad to have discovered this model that I think a couple of people know about. It's the Multicultural Emergency Management Partnership model. But I discovered it, about a year, 6 to 12 months after it was being developed. So we do need to collaborate. Thankfully, the 6 priorities we align with expertly, and I've been talking to Bridget T and anyone else who will listen about the alignment with that. Recommendations for future work. I've got quite a few. We sit with those major service providers every year for the last 3 years to review and update our information. They need to be reviewed, they need to be updated with the people they're directed at and with the content experts. We need to increase the reach of resources relevant via social media during periods of peak interest. Now, this is what my refugee team are telling me. We need to be able to have large and small group interventions. We need to have conversations. Remember these people. A fire in a camp on the Thai-Burmese border goes like this. I'm lighting my fire, I'm cooking my quota of rice that I get for a month with fish paste, and that's all I get. The flame escapes and goes up the side of the bamboo hut. That is fire in the camp. When you think about fire in Bendigo, Victoria, Australia, embers, deaths, it's very different. Flooding. They know when the big river along between Thailand and Myanmar is going to flood. They know to stay away from that. So there are different activities. We need to collect data. I don't believe there's enough research done on how we can embed these messages and into orientation to Australia. I want to collect more data and work with whoever wants to work with me and Bendigo Community Health, looking at how we capture the settlement data, periods of settlement and uptake of knowledge with current information systems that we have. I want to expand sessions delivered to the emergency personnel on an annual basis. It needs to be part of their orientation and it needs to be part of their workforce. I want to promote and support volunteering careers for our former refugees. Why can't we have a Karen fire engine driver, for instance? I want to reinforce the need for emergency warning systems to be accessible for all local people of refugee background. I'm sad to say that the VEA, which is no news to you, does not work for many people with English as a second language. And as mentioned, people with poor data stores and old phones, basically. It's really, the assumption and the reliance on that is really dangerous. We need to get back to fridge magnets and other ways. The power goes out anyway, so what happens? We need to replicate this. I'm happy to replicate this model if people think it's going to be useful for other communities. And what really struck me this year through COVID, being part of the Hurrah complex, the Hurrah program, I worked with a lot of people in social housing. What we've developed in simple English would be really useful for people in social housing with poor literacy in English. So messages are too complicated. This is a fridge magnet. Where do you go? What do you do? We need to, I want to scale up and test this model. This is a regional model. I want to scale it up and test it with other settlement groups. And we need to advocate the need to embed emergency preparedness and safe, sustainable living, for goodness sake, into refugee settlement programs across Australia. It's a no-brainer, isn't it? We don't have the capacity. We manage HSP settlement. They're flat out getting people to learn how to use the bus and get health assessments, let alone anything else. So at Bendigo Community Health, when we took on humanitarian settlement, I said, we're not going to create a ghetto. We're going to develop all these other programs which I have developed. We work with other peak bodies, Dementia Australia, Cancer Victoria. We've got health navigation programs. We shouldn't have to do that. It should be part of orientation. And we need to elevate and look at this model and other models and embed them into national and other international frameworks. I really loved what I've heard so far this morning. Emma, I'd like you, where's Emma? I'd love you to add people with little English to your list of who is vulnerable. And Margarita, talk about the quadruple whammy, add the refugee folk. I think the other message for me is community leaders are exhausted. Let's stop talking about we should be funding them. Community leaders of different ethnic groups of which I'm involved with are exhausted. Exhausted. Do not expect them to be voluntarily doing these things. They are exhausted. Recognise their sphere of influence, recognise their insights and walk beside. The reach that we've had we've set up a refugee resource hub on our website. We even get people accessing our information from the camps. We set up this COVID resource hub in March 2020 when I realised with great horror that half of the people I work with could be struck down because they've got very little English, so we went about that. The other thing I recognise with having the privilege of working in the HURRAH model, the high risk accommodation model through COVID, is that what I'm talking about with refugees of little English and different backgrounds could also be applied, and the value of community health centres in Victoria. It's a different model in Victoria. We have community health centres. We're not acute settings. We are there. Our remit is to work with vulnerable people. Work with us. Recognise it. I want to add, the last thing would be home safety, safe living. We have refugees that have never lived in a house before. They get their first house, and our emergency planning says, don't forget to take your car keys. Have your car fueled up, have the headlights on, take your car keys. And this is the first time they've lived in a house. I realised that when we were talking about, with groups about planning, one of them said to me, this is the first time I've ever had a key. I'll have to remember where we put it. This is the first time I've ever had... So our messages are stupid, aren't they, really? Some of them. For this community, we need to drill back and listen. I've got a lot of stories, but we're out of time. One of the sessions that we were doing on heat with our champions, halfway through, we had a water break, didn't we? I said, how are you going, And this gentleman said, he'd been in Australia for 2 years. He said to me, I think I've found a good place to keep my children safe in the summer. He said, I've just got my licence, I'll put them in the car. Now, he didn't understand. That was the first car he ever had. To him, it looks like an insulated, safe place. Let's not prosecute, let's not blame. This is my last message. Let's not prosecute, let's not blame, let's educate and let's plan. We know what's ahead. I'm today standing here sharing the voices of our refugee community. It's a great privilege, and thank you for listening.